Well, these countries are risk, and in fact, there was a recent assessment done of 45 low-income countries, a preparedness assessment for COVID, and none of them passed that assessment. So I do think we need to be very concerned. And the main reasons, as we've just been hearing, that those health systems are at risk is that the health of the population is often poor in the first instance, poor nutrition and general physical health. Healthcare systems are already overwhelmed just by routine cases. Resourcing is very limited. Supply chains also are highly problematic for medicines or diagnostics in those systems. They often have populations that are living in overcrowded conditions, or they're in unstable employment. So these are all big risks. In terms of trying to address it, there are actually a number of things that are really quite basic, which we need to focus on first. And one of those is water and sanitation for hand washing, and if people don't have access to that, that's highly problematic. And on also simple things that governments are considering, like cash transfers for vulnerable groups who may need to be protected. And then finally, we really need in those countries to protect the health and the availability of the existing healthcare workforce to be able to cope with coronavirus.
Well, Professor, actually now Africa is fighting two outbreaks. One is Ebola, the other is COVID-19. So can this continent survive a double strike?
Well, actually, ironically, we've seen promising signs from some African countries who had the experience of Ebola. So they have preparedness because they've seen a previous epidemic that was very serious for their healthcare systems. And in terms of a pan-Africa response, there has been an African task force for coronavirus set up by the African CDC, the Regional Office for Africa of the World Health Organization, trying to coordinate action across countries. So it is a double challenge, but in some ways, I could argue that some African countries have been trying to get ready earlier, in fact, than some of the European countries and the US have been.
So, Professor, how optimistic are you, and how will the situation in such places affect the world as a whole?
Well, I think we need to recognize that low and middle income countries are incredibly diverse. They each face different challenges. And even in Africa as a continent, response is highly variable. So Senegal, for example, is being held up as an example. They received $20 million from the World Bank, and they are implementing tracing and tracking and testing, and their health ministry has put clinics at the ready, and of course they're seeing cases, and so are other countries. So some African countries will be badly affected and others not as badly affected. In terms of how it will affect the rest of the world, we will have to see. We're seeing the transmission of this virus globally, even though countries are closing their borders. And I think trying to enforce social distancing and non-travel between countries is actually going to be really important to try and contain this, so that systems are not completely overwhelmed where they're needed the most.
And Professor, in terms of help or aid, so what kind of help do you think are mostly urgent needed by those regions and countries?
Absolutely. Yeah, I mean, I made the point about the supply chain. There's a huge global competition now for ventilators, for testing equipment. And when we get to the stage where we have an antibody test, which we don't have yet, there'll be huge competition for that. So we need the global donors, the international development community to step up and support countries. And we also need the high-income countries that have the resources to look to Africa and other low and middle-income countries to try and bolster their response. So it really needs to be a global, coordinated effort. This is not the time for countries to be disagreeing with one another. We all need to work together.